Thank you guys for taking the time and watching my videos and hitting that subscribe button. We've gotten nothing but positive feedback for the first month we've been doing this. I think we're close to 100 subscribers already. We've had good response on Facebook and Instagram too. So appreciate you guys. But during this first month, we've also had a lot of questions. We've had a lot of questions about what is chiropractic, what we're doing in these videos. You know, we hear the popping and cracking, and kind of how I've explained previously, that's not always the goal of what we're trying to do. Our goal is to obviously get people feeling better, but by doing so, we're trying to restore motion in people's bodies, help them move better, get them back to doing what they love doing, whether it's just walking or playing with their grandkids or performing the sport that they play on a regular basis or training for that sport. And by doing so, we've been doing a lot of muscle work, we've been doing a lot of adjusting, things like that. But more specifically, people have been asking what exactly is the chiropractic adjustment, what's the goal of that, and how is it beneficial to people. So during these videos, you've kind of seen me assess people. What we're doing during that is taking them through full ranges of motion and big regions of their body, specifically the neck, that mid-back, that low back area, but also in their extremities as well, with their shoulders, their hips, their ankles. But then we also dive a little bit deeper into that range of motion too, and we go into the segmental portion of it, and we dive into that joint motion. So in the back, we have a lot of different vertebrae. We have the cervical spine, we have that lumbar spine in the low back, and then the mid back we have that thoracic spine, and they're all made up of vertebrae, and each vertebrae, when they connect to each other, have several different joints, and a lot of times they can become restricted. And what I mean by that is if you kind of think of each one of these beads being a vertebrae and in between is a joint, normal motion in the spine specifically is when they move, each one should help the next one move, and we have that nice joint motion, okay? And we can move in 6 different ways. We can forward flex, we can backwards extend, right, left lateral bend, and rotate to the right and left as well. So like I said, normal, each one helps the next one move. We get that nice curvature motion. But when there's joint restriction, whether it's between 2 vertebrae or a whole region, they become restricted and start moving together. This can cause a lot of issues with tight muscles, tight joints. If we let it go for a long period of time, chronic pain can set in, arthritis starts happening. And so what we do as chiropractors, when we're assessing, going through that range of motion, we palpate the spine through motion palpation. We see how that spine is moving. And what I mean by that is I go through each vertebrae, each one of those joints, find those restrictions, and the adjustment itself is just a quick thrust right into that joint in the direction that it's restricted to help restore that motion. And by doing that, we're freeing up that ranges of motion. The muscles start to relax a little bit. We're also facilitating the nervous system, allowing that brain to have that connection where they're feeling, okay, this is the way I should be moving. So we're also re-educating the brain and the body of how it should be moving. So what we do is essentially we focus on motion. We make sure people are moving good. We make sure that that motion stays with them for long periods of time, and we re-educate that patient's body as well. So I hope this helps you guys answer some of those questions about what we're doing here in the clinic and what I do as a chiropractor. Again, thank you guys for watching these videos. We look forward to getting you more content on a regular basis, and thank you for watching. See you soon.